afternoon, everyone. As of about the last 30 to 45 seconds, we are happy to have you here today. My name is David Humphrey. I'm an admissions counselor here at Baylor. I'm excited to be here to help present the Medical Humanities session. Today we have Dr. Lauren Barron, who is the DeBakey Chair of our Medical Humanities Department, Clinical Professor and Undergraduate Program Director. So she'll be presenting some information with you through the presentation. If you all have questions at any point, please feel free to send those in through the Q&A and chat. We'll have some time to address those at the end, but I'll go ahead and hand it over to Dr. Barron.
Hi, everybody. Welcome. I know that it's a beautiful Saturday here in Waco, Texas, and I'm really excited to be able to tell you everything I can about the Medical Humanities program in 15 to 20 minutes. I want to encourage you to ask questions, and we'll get started here. So a lot of people have questions about medical humanities. What in the world is medical humanities? And I'm going to help explain it. So I want to start with this picture of our students on a bridge, because I think of medical humanities as building a bridge between the art and science of medicine. And these students are standing on the Waco Suspension Bridge over the Brazos River, which is our river that flows right by Baylor University. The name of the river, the full name of the river is actually Brazos de Dios. Los Brazos de Dios means the arms of God. And for the very first time, as I'm looking at this slide, I see a car behind them. And so that must have been a very interesting picture to take. I imagine they scattered right after that. So what's medical humanities? Well, the way I describe medical humanities is that it's a bridge between the art and science of medicine. It's the best of a liberal arts degree with a medical focus, and that we're trying to turn pre-med and pre-health students into humans before their medical training turns them into gods, robots, jerks, or some combination of the above. That's my elevator pitch. The official definition is that we're an interdisciplinary and interprofessional path for our students in the context of a Christian community to become capable and compassionate healthcare leaders for our world. And boy, do we need this, right? We really want to reclaim the Christian voice to create capable and compassionate healthcare leaders in all the fields for our world. So what do you study in medical humanities? How do we do this? Well, there are four main pillars of medical humanities. So think about philosophy and medical ethics, literature and the arts in medicine, the history of medicine, and spirituality or religious practice in medicine. These are the four main pillars. And what I want to show you with this image on the right is that the American Association of Medical Colleges, these are the people who write the MCAT, okay? They've recently put out a report called The Fundamental Role of the Arts and Humanities in Medical Education. So this is not just me saying this. This is not just Baylor University saying this. This is the American Association of Medical Colleges that says that the arts and humanities have a pivotal foundational role, a fundamental role in medical education. So I've already told you my definition, and if that helps you, that's fantastic. Sometimes it helps people to understand better what medical humanities is if we can tell them the classes that we teach. So literary and philosophical perspectives on medicine, that's a class I'm teaching right now that pulls in passages of literature, of great literature from the patient perspective and also from the physician perspective, together with the examination of philosophy on medicine. Christian spirituality and healthcare helps us reclaim that Christian voice. A lot of people don't realize that hospitals and healthcare institutions were rooted in Christianity. So the history of hospitals is rooted in early Christianity. And a lot of people don't realize how significant that is. Of course, medical ethics. You know, when I was going through my medical school and residency, I'm a family practice physician. And when I was going through medical school, we might have an hour in medical ethics kind of tacked on somewhere, but we didn't study medical ethics in depth. And the genius of the medical humanities program at Baylor is to have medical ethics, history of medicine, Christian spirituality and healthcare, have these things as the foundation that further training is built on top of, not have it as something that you try to cram into the curriculum later on. So this forms an amazing foundation. And I always like to say that I'm teaching to my 20-year-old self that these are the classes I wish I had had before I went to medical school that would have helped me be the physician I wanted to be. I've been a physician for 30 years now, and I have spent my career gathering up the tools that I needed that medical school didn't help provide me with. There are other tools, there are other things that I needed to gather those up. And now I can share those with my students. I may not know what they're going to need this toolbox for, and I may not know which tools they're going to need, but we can at least hand them a toolbox. And that's what the Medical Humanities program does. So I want to emphasize that we are compatible with all kinds of pre-health programs, not just for pre-med students. A lot of you who are listening, or a lot of you parents, the idea is probably medical school at this point, but it may change. So although I am an MD, I am a family doctor, I'm really proud of our program that we have students who are going into healthcare administration, healthcare policy. We have a lot of students going into law, going into healthcare law, social justice. We have, you'll see in a minute some of the different opportunities. But no matter whether they are a major or a minor, these are the 3 courses that we build our foundation on, which you're able to read there. I'm also teaching the Introduction to Medical Humanities class right now, and it is so fun. I love this class because it's like a sampler of all of these 4 different areas. And here towards the end of the semester, we're on the religion and medicine aspect of the course, and it's fantastic for a reason I'll show you in just a minute. So if you have the major, you're going to take those 3 core courses, and you're going to take 1 course from each of these areas below. You see listed there 1 through 6, plus you have room for 2 electives. So that's how the major is constructed. So a lot of you want to know, what can you do with the degree in medical humanities? Well, I think of a medical humanities degree, as I told you, as building an incredible foundation that you can build anything you want to do in or around healthcare on top of this. So you can see here, yes, we have pre-med students. We also have nursing students. We have people who are going to be physician's assistants, social work, counseling, psychotherapy, pastoral care, seminary, chaplaincy, occupational therapy, physical therapy, pharmacy, law. We have a lot of students who are interested in clinical ethics. And so I am very, very proud, especially as a family doctor, because I understand that it's not all about the doctor anymore. We need multidisciplinary teams to work together to do the best care for patients. And so as a family physician, I understand this, and I think it's so important, and it makes the classroom so much richer and fuller to have students who are in all these different areas, bringing their different perspectives to the classroom. So that's really important to us. Another thing I want to emphasize for some people who might think, well, don't you need to be a biology major? Don't you need to be a chemistry major to go to medical school and to be, to have a better application for medical school? And what I want to show you is that the Texas medical schools are reporting that more than 50% of their students are coming in with something other than a biology or chemistry or biochemistry degree. So they're looking for students who obviously they need to excel and do incredibly well in the sciences, right? I'm not saying ditch the sciences at all. Excellence and excellent academic performance in the sciences, if you want to go to medical school, is not an option. But what I am saying is complementing it with the humanities or social sciences is something that medical schools are looking for. And our students in medical humanities tell us, we get letters all the time thanking us for their background in medical humanities and telling us what a benefit it's been to them and how much they appreciate it. And actually, I think I'm going to do something I've never done before. And I'm going to look up a text that I just got from a student of mine who's going to be a vascular surgeon. I've never done this before. And he sent me this text. He says, I just finished my 7th interview for vascular surgery. That's before he matched. Felt it was worthwhile for you to know the program director was very interested in my medical humanities background, and we talked a lot about how it shaped me over the years. He was very much wanting to learn more, and I, of course, directed him to the program website. And then he goes on to say, no matter where I go, it's always something that is the foundation of who I am and anything good I can do. So you can always tell your students, once you're a part of this, he means medical humanities, it's with you for life. Oh, makes me get a little emotional reading that. So our students really tell the story about how significant it's been for them. And I could give you lots of other stories like that. I wish I had time, but they all almost make me cry. So I want you to see here that medical humanities is not just, I'm not just telling you about it, and Baylor's not just telling you about it, but this is a phenomenon all over the country. So some universities call their programs health humanities and some call them medical humanities. Baccalaureate basically means it's a bachelor's level program. And you can see on the right, I don't know if you can see my arrow or not. I'm going to assume that you can't, but on the top right, that you can see the growth of the numbers of programs, and we're well over 100 programs now in the United States, but you need to know Baylor was one of the first. So don't forget that. Baylor was one of the very first who was doing this early on. And you can see that some of these schools have only the minor, some of them offer a certificate, some of them offer a concentration, some of them only offer a major. Baylor offers a major and a minor, both of those. And so now I want to shift to talk about that sort of tension in our culture between science and the humanities. So there's this idea in our culture that science is the most important, and some would say the only way of knowing and learning, because science has such a high prestige in our culture, and it should, right? But science is only one way of looking at the world, okay? And so when we think of the scientific way of knowing, which we have to have excellence in, as I've said, it's about facts, it's about procedures that we can replicate, it's about universal rules that apply to everyone, everywhere. These are scientific truths or things that we can generalize to everyone and everybody. And it's about objectivity, and science helps us with the biophysical understanding of disease, okay? But the humanities are a different way of knowing, all right? It's more about stories. It's more about what is the individual perspective, what's unique, what's particular. The fact that multiple perspectives can exist simultaneously, right? We see that in novels, we see that in film, we see that in history. The fact that there are multiple ways of looking at the same situation. And the humanities help us more with a psychological and social and spiritual understanding of illness, the experience of illness, all right? So when we put these two things side by side, we get a fuller picture. And one of my favorite examples of this is an excerpt from a piece of writing from Dr. Eric Cassell, who you should read everything he wrote because he was amazing and he loved Baylor University and he loved our program, and he was my dear friend who just passed away last year. You should read everything he's written because it's brilliant. In the meantime, this is one of my favorite examples that he gave to us that I always, it's my go-to. Imagine if you had a rose, okay, and your job was to describe this rose, but the only tool you were given to do that was a ruler. So imagine your job is to describe the reality of a rose, but the only thing you can do that with is a ruler. Well, the picture that's going to emerge is going to be true in terms of inches, but that's going to be pretty incomplete. We can all agree that if a ruler was our only way of describing things, we're not going to know, we're not going to have the complete picture. And if the only thing we had was a ruler, we're not even going to know that the picture's incomplete. So that's one of my favorite ways to describe the different ways of knowing that we need to put together to get a complete picture. So if I wanted to talk to my students about migraine, and this would be an example of the kind of lecture I would get in medical school or residency. The professor would be talking about the fact that it's a neurovascular disorder, that there's local intracranial vasodilation and neuropeptides that get released in the trigeminal distribution of the fifth cranial nerve. And they're going to be talking about triptans, and they're going to be talking about receptors and rizatriptan, and they're going to be talking about all these agonist drugs. And that's important. We need to understand all of that. But when I lay this explanation of migraine next to this painting, next to the self-portrait of a woman who portrayed what migraine was like, the experience of migraine, what it was like, she tried to visually depict this. I think this gives us a fuller understanding of the experience of migraine than just the description on the left. And I'm just going to assume that you can agree with me, even though I can't see your faces. The other distinctive about the medical humanities program in the last couple of minutes that I have is the vital partnerships that we've been able to create. So for those of you who are from Houston, Texas, my hometown, you'll know the DeBakey name. Dr. DeBakey was a pioneering heart surgeon, helped in the very, very earliest days of open heart surgery. And to have the support of the DeBakey Foundation, who's given us a fund where we're able to give several $10,000 scholarships. You can see here, that's an incredible, to have their endorsement, the endorsement of the DeBakey Foundation is an incredible source of pride and honor for our program. Another partnership we have is with Waco Family Medicine. So Waco Family Medicine is one of the best family practice residency programs in the entire country. Look it up. Don't just trust me. Don't ever take one person's opinion or advice on anything. Trust and verify. Go look it up. It's one of the best programs in the nation, and I should know because I was a resident there and I was on faculty there for many years. And so that has allowed the Medical Humanities program and Baylor University to build a lot of partnerships with Waco Family Medicine. And our students are now able to volunteer there. They're able to be research assistants. They're able to shadow, form partnerships with the clinics. They're able to understand the significance of primary care, care of the underserved, and it's an amazing partnership. And the Medical Humanities has been foundational and pivotal in creating that. And then, as I just mentioned, I need to update the slide, but we've just introduced our 2022 DeBakey Scholars, and that is a very high academic honor. And the DeBakey Foundation has been so generous that they actually gave a $2 million gift to fund the DeBakey Chair in Medical Humanities, which I'm the inaugural holder of. And I can tell you it will always be one of the greatest honors of my life to have been designated the DeBakey Chair. So that shows you some endorsement from our program. If you want to know more of what our students say, I encourage you to look up the article you see on your left, which is a thinly veiled attempt to quote Baylor students about our program. All right, scholarly works are not my forte. I'm a clinician and a teacher in the classroom, but as one of our faculty, we do have a world-class scholar, and that's Dr. Jeff Levin. He's an epidemiologist, and he has written a stack of books higher than my head on the intersection of faith and healing, or religious practice and medicine, however you want to describe it. Dr. Jeff Levin is a world-class, he's just a world-renowned expert in this area. And in fact, as an example, I can tell you he was the guest speaker in my Intro to Medical Humanities class just last week, and is an amazing, rich resource for us at Baylor, and actually for the whole world, in showing how religious practice and faith positively correlate with good health. And then Dr. Hoy, who's my other partner in the program, his background is pastoral care and hospice work, and he has written widely about bereavement and end of life and funeral practices. And it's wonderful to have these scholars complement us as clinicians and teachers in the program. One other aspect of the program that I want to emphasize, I've already said that AAMC, that's the American Association of Medical Colleges. On the right, you can see the competencies or the values that they want their applicants to medical school to have. And you can read that as well as I can. But I want you to see that on the left, how much these things correlate and overlap with the traditional Christian virtues or values. And so at Baylor, we are not ashamed. We don't try to hide the Christian influence that we believe an education should have in developing you as a student, or your student, your son or daughter as a student. And so you can see how the Christian virtues really are alternative ways of phrasing the competencies that AAMC says they want in their students. So that's another distinctive that Baylor has, is we try to build these Christian virtues into our students. This slide is just an example of the kinds of events and opportunities that we like to have. Now, obviously, we all know the past 2 years have been disrupted with COVID, but I want you to see the number and the different kinds of gatherings and events that we have. I also want you to see that every spring we have a medical humanities retreat, and that is focused on medicine as a sacred calling, not just as a career, a vocation, not just as a job. This past year we had, we did have it this spring, and the emphasis was on the idea of taking spiritual histories from our patients. We take social histories, we take family histories, we take surgical histories. So how do we properly include the spiritual aspect of our patients into our care for them? And how do we do this in a way that doesn't exploit the patient, that doesn't exploit the power differential between practitioners and patients? How do we do this in a way that honors our patients and honors God? So that is a cornerstone of our year, is the retreat in the spring. But you can also see these other gatherings that we're going to get back to this next year. You can follow us on social media. We have a really active Instagram page. Students, I know that Facebook isn't cool anymore, okay, but your parents and grandparents might not know that. So you can point them to the Facebook page that we have that gives you an idea of the character of our program. And lastly, I just want to close with my a quote that's my favorite quote that I really like to share with my students, and that is from Dr. Rachel Naomi Remen. Again, remember, I'm not saying the sciences aren't important. That is not what I'm saying. I want you to make A's in all of your sciences, but that medicine is closer to love than it is to science, that we need both of these to give us the best understanding of who our patients are and who we are as practitioners. So go to our webpage and you will learn more about us than you could ever want to know. It's a great place to start exploring. But right now, I want to turn it over to David, who's going to help me with some questions that you all have.
Yeah, so we have some great questions. Some that will include just kind of double majoring. So we have questions about if you can major in medical humanities, minor in theater, double major in medical humanities and biology or other medical school prerequisite courses can be included in the major. So do you want to just kind of talk briefly about what that looks like to take this in additional areas?
Yes, so let me give you my 3-bucket model. Okay, so 3 buckets when you're choosing your courses. You've got to think about your bachelor's degree, Bachelor of Arts, Bachelor of Science, your general, there's going to be general degree requirements, okay? Your other bucket is going to be your majors or your minors, the bucket that fills up the requirements for your major or minor. And then if you're on a pre-health or pre-med track, you've got to think about, or pre-law or whatever it is, you've got to think about what your requirements are for that 3rd bucket. So your general degree, your major or your minor, and then any pre-health or any other track that you're on. Those are the 3 things. So as long as you pay attention to those buckets, that's going to help you, because some of the courses are going to help fill up 2 of your buckets. Okay. It's going to be rare that a course will help fill up 3 buckets, but it might. Okay. So all that to say, keep those 3 buckets in mind. And the short answer is yes, you are able to do double majors and you're able to add minors. And also fulfill your requirements for your pre-health, pre-med track. We have students doing that all the time. So just the short answer is yes. Again, don't take just my word for it, okay? Trust and verify, look it up yourself, but absolutely you're able to do that. Now I want to make a caveat here. Whatever it is that you're planning to do afterwards, my philosophy is to study what you love, okay? I loved psychology. I figured out early on that I did not have to do a degree in biology or chemistry. Chemistry is not my love language, okay? I would like to say I've never had a patient ask me an organic chemistry question, not even one time. But that aside, chemistry is not my love language. When I stumbled into psychology courses, I loved those. And so I did my degree. I figured out that you don't have to do a degree in biology or chemistry or biochemistry to go to medical school. So I thought, well, I'm going to be learning biology and chemistry for the rest of my life. I'd like to spend my university education studying something else that I'm not going to be able to study so deeply. So I did a degree in psychology, also had my, of course, my pre-med requirements, and I was also in the honors program. So I did my requirements for the honors program. So that's how I did my education. So yes, you have the room to design it the way you want to, but study what you love. That's my main advice. What else, David?
All right, so we do have to, I believe, close so we can get to our next session. But Dr. Barron, thank you again for sharing this information. If you want to go back to your contact information, students, you can feel free to reach out to Dr. Barron or our medical humanities department. We have to any of these additional questions that you may have. But students, y'all can go back to your main session page and go to any of the 12:30 sessions. Thank you again, Dr. Barron, for being here.
Okay, bye-bye.
Yes, take care.